Good morning, one and all. This is Priya from MedWorld Expo, which is a unified digital healthcare platform that connects manufacturers and distributors worldwide, while also bringing hospitals, clinics, laboratories, and healthcare experts like you onto one platform. It gives me great pleasure to welcome you all to today's webinar. It's my privilege to introduce our esteemed speaker for today's session, Dr. Arshina Suroor, who is a senior resident in the emergency department based at Dubai and has been associated with this field for over 11 years. After completing her post-graduation, Dr. Arshina went on to pursue a postgraduate diploma in family medicine, equipping herself with the skills to manage and cater to the heavy patient flow in green clinics. Her commitment has always been to apply her expertise in the best possible way to serve people while continuously learning and sharing knowledge. Today, she will be enlightening us on a very crucial topic, anaphylaxis, a life threatening emergency. This is a subject of utmost importance as timely recognition and intervention can save lives. We are truly honored to have her with us today, and I invite all of you to join me in warmly welcoming Dr. Arshina. Over to you, ma'am.
Hello, everyone. Good morning. Thank you for joining me here. So I am an emergency physician for the past 11 years, and I have experience in dealing emergency cases in primary setup and also in tertiary setup. So today we will be dealing with anaphylaxis, which is a very life-threatening condition. And usually it gets ignored, thinking that it's just an allergic reaction. So it's very important for all of us to know what is the difference between a normal allergic reaction and anaphylaxis. So dealing with anaphylaxis is very important as it can lead to death. And it is a very rapid progression of the symptoms, which causes death in such patients. So understanding what is anaphylaxis is important even for a layman, because initial and prompt management can lead to life-saving, can save a life of a patient. So to brief you about what is anaphylaxis, I would like to share my screen. And we'll try to understand what is anaphylaxis first. As many of you may be knowing, but still it is defined as a severe and life-threatening generalized or systemic hypersensitivity reaction in the body. That means a normal allergic reaction is just presenting as itching and rash, maybe to an allergen, but an anaphylaxis, I hope you can see my screen, everybody.
Yeah, we can see your screen.
Okay, yes. So anaphylaxis is defined as severe life-threatening and generalized or systemic hypersensitivity reaction. It is more than normal allergic reaction. So how does it differ? It differs because a normal allergic reaction will not lead you to death, but yes, anaphylaxis can. So then why is it important to identify? Because you can take certain steps which can help you in preventing this death. So what causes anaphylaxis? Anaphylaxis is usually caused by any allergen, like how an allergic reaction is caused. Anaphylaxis is caused by simple allergen. So identifying the allergen is very important in such cases. So what are the common allergens that we know? Food is the most common cause, especially in children. So seafood and lobster, dairy products, eggs, citrus fruits, mangoes, strawberries, tomatoes, and even milk can cause these allergic reactions. But most common is peanuts and seafood allergies. Others are like drugs, which can also cause allergic reactions like NSAIDs, antibiotic, anti-sera, like that is injection, TT, tetanus injections, and even that immunoglobulin, which you administer. Venom, that is bee sting or wasp sting, can also cause anaphylaxis. So any allergy can progress to anaphylaxis. What is the mechanism of anaphylaxis? So to understand what leads to anaphylaxis, we should know what it is. It is a type 1 hypersensitivity reaction, which is IgE mediated. So any allergic reaction, that is hypersensitivity reaction type 1, which is IgE mediated, can lead to anaphylaxis. What you understand from IgE mediated is first, when there is an allergen produced, exposed in a patient, that produces an response which leads to sensitized mast cells and basophils, which degranulates in the second exposure. So degranulation leads to release of inflammatory markers, which leads to severe form of generalized reaction in the body. So what is the severe form of reaction which develops due to these inflammatory markers? That is vasodilation and increased vascular permeability and bronchoconstriction. This leads to the life-threatening changes which occurs in the body. Now, what predisposes a patient to have this type of response? Why some persons get exposed but don't develop this response while others? So many studies have shown that there is genetic predisposition. Like a person is predisposed genetically to have such response to the allergen. That is why some people respond in this way while others don't. So it is just a genetic predisposition, and you will find a family history in such patients that they have atopy or allergic reactions to certain foods, or maybe bee sting or some antibiotics or some drugs. So what is the presentation of anaphylaxis actually? To understand the presentation, we should know that it may just present initially with itching and rash, but later in few minutes, rapidly it progresses to anaphylaxis. So the patient will complain of immediately after consuming some food, or maybe exposed to some bee sting or some chemicals, or after taking antibiotic, few minutes or 1 or 2 hours. It may present with symptoms like they complain of itching, rashes, urticaria, which presents as wheals on the body. They can have dizziness, fainting, and loss of consciousness also. They can be eye swelling and watering from the eyes. The patient will be tachycardic, and he will have swelling. He may or may not have oral symptoms of angioedema, that is involvement of the skin and mucosa of the oral cavity and the upper respiratory system, which presents as swelling of the lips, oral cavity, which worsens further the breathing difficulty, which occurs because of bronchospasm. And also they can present with cramps, abdomen pain, nausea, vomiting, diarrhea. They can complain of chest pain because of the bronchoconstriction and heavy breathing. And also they can have swelling in the hands and feet and the genitalia. So a simple itch and rash can progress further to compromise the airway breathing of the patient and leads to anaphylaxis and anaphylactic shock. So what is the importance of understanding this anaphylaxis? That is a presentation. So a simple itch and rash, you should not misdiagnose a simple allergic reaction, because you never know, the patient can progress to having an airway, breathing, and circulatory collapse. So the patient presents at home with some rash, and then he starts breathing heavily, and then he will complain of some dizziness and can faint also. So the prompt response should be done, like seeking a medical advice. However, a patient may be in the emergency department as well, presenting with the itch and rash, and suddenly saying that he cannot breathe or may collapse there as well. So the patient progresses rapidly, and the symptoms will include airway, breathing, and circulatory problems. Airway problem can be the swelling of the throat and swelling of the throat cavity, oral cavity, and the tongue, which leads to stridor and hoarseness of the voice. Breathing problems like respiratory wheeze and dyspnea can be seen. Tachypneic, tachycardic patient, and also tachycardia will be seen, and hypotension will be there. When you check the BP of the patient, there will be hypotension, there will be tachycardia, the patient will have breathing problems like respiratory wheeze, and the patient looks tachypneic and swelling all over the body, rash. This will be the presentation. However, if there is no compromise of airway, breathing, and circulation, it cannot be labeled as anaphylaxis. Yes, you can call it an urticaria maybe, or an allergic reaction. So Around 80 to 90% of the patients also have skin and mucosal changes. That is generalized pruritus, widespread erythematous, or urticarial rash can be seen. However, not necessary that angioedema be there. Angioedema is the involvement of the mucosa of the oral cavity, which can present separately from the anaphylaxis. But it can be a part of anaphylactic reaction or anaphylactic shock. So the patient may have these symptoms, and these symptoms are caused because of the pro-inflammatory markers, that is histamine, which is and other like leukotrienes and cytokines, which are released from the mast cells and basophils, and this leads to these reactions. What will be the management? Management is very important because it needs early treatment and recognition. First, recognition and early treatment, because as I told you, it can lead to life-threatening condition and death. So the first, when you see a patient with allergic reaction getting worsened, like a layman can see that he is just lying down, he's telling he's feeling dizzy, he cannot breathe, and you see him breathing heavily, then what you will do is you'll make him lie down flat or semi-recumbent position and seek medical attention as early as possible. If at all the patient has a history of anaphylaxis and there are his family members surrounding him, they know that he has suffered this before. So most probably they will have their emergency drugs available at home or with the patient. So that is usually an preloaded adrenaline syringe or EpiPen. EpiPen may not be available in India, but yes, preloaded adrenaline can be present with the patient. And giving that intramuscularly on the patient thigh is the first treatment or the first response. Suppose if that is not available and the patient is suffering for the first time, or there are no family members surrounding the patient, or the patient doesn't have the adrenaline with him, immediately shifting the patient to the first nearest hospital is the treatment, or is the first response that should be present. And then, so intramuscular adrenaline is by far the most important drug in anaphylaxis and should be given as soon as possible. Previously, it was thought that steroids, hydrocortisone, was recommended, but now it is not. It has been removed from the guidelines. Only stabilization is managing the patient in emergency department, seeing that his vitals become stable, and adrenaline is given. And how far can you give adrenaline? You can give adrenaline every five minutes till the patient becomes stabilized. So the best site of IM injection is anterolateral aspect of the middle of the thigh. So the recommended doses are different based on the age and age of the patient for adrenaline. And adrenaline is available in 1 in 1,000 and 1 in 10,000 dilution. However, we use 1 in 1,000 dilution for anaphylactic reaction to give the patients. And it should be made sure that that dilution is given to the patient. So age of the patient less than 6 months needs a 0.1 or 0.15 ml of adrenaline given in intramuscularly on the anterolateral aspect of the thigh. And patients of age 6 months to 6 years of age need 0.15 to 1 ml of 0.15 ml in 1 in 1,000 dilution, while 6 to 12 years need 0.3 ml in 1 in 1,000 dilution of the adrenaline, and adults and kids more than 12 years of age needs 0.5 ml. So these are the recommended doses we need to give as first response to any patient presenting with anaphylaxis. And it is ideal to remember this because you don't get enough time to calculate and then give. So ideally, based on the age, you're supposed to give it as a prompt response. And 0.5 ml is actually 0.5 milligrams because it is equivalent to 0.5 milligrams of 1 in 1,000 adrenaline. So anaphylaxis, as I told you, this is like guidelines from the UK Resuscitation Council given as what you should do when you see a patient with anaphylaxis. As I told you, we need to stabilize airway, breathing, circulation, expose the patient, and check for the disability. Suppose if the patient is exposed to any available chemical reaction, that is chemicals which has been there in contact over the skin, you can remove it, you can wipe it. So that exposure helps in that way. So diagnosis, sudden onset of airway and breathing, circulatory problems, and usually skin changes are seen. So look for these, and the patient will be tachypneic, tachycardic. You can see him breathing heavily. Probably you can hear a stridor as well. Call for help immediately. Resuscitation team or an ambulance should be called. While waiting for the ambulance, you can make the patient lie down or have it in the semi-recumbent position, which is a upheld position. Upper body is held little upheld so that he can breathe properly. So remove the triggers as far as possible. Make the patient lie down with the legs elevated. Elevating the legs will improve the blood circulation to the brain. A sitting position can make the patient breathe easy. If the patient is pregnant, make her lie down left laterally. So give as early as possible intramuscular adrenaline. So a patient with prompt response, it is we can continue with further management of giving high flow oxygen and monitoring the blood pressure, taking the blood for testing and do an ECG. However, if there is no response to the first dose of intramuscular adrenaline, we can give one more dose every 5 minutes. And when you know that the patient is needing the repeated dose of intramuscular adrenaline, you have to give other measures like giving IV fluid bolus and call in for help from other departments in emergency, so that maybe the patient we may need an endotracheal intubation to protect the airway. So in that case, it is apt to involve other departments promptly, because you know that the patient can collapse anytime and you don't want to compromise the airways. So if no improvement is seen in breathing or circulation, despite 2 doses of intramuscular adrenaline, we confirm it as a refractory anaphylaxis. Refractory anaphylaxis is anaphylaxis which is not responding to the IM adrenaline, despite 2 doses given. So this is refractory anaphylaxis that should be managed in emergency department. And established dedicated peripheral IV or IO access should be secure as early as possible. And giving intramuscular insulin should be continued till you can secure an infusion of adrenaline. IV infusion can be started in a dose of 1 ml of 1 mg per ml of 1 in 1000 adrenaline. So it can be given. Be alert, conscious, make alert everybody that this patient is having refractory anaphylaxis. He can collapse anytime. Involve your seniors, involve the anesthetist, because even the airway, securing the airway can be difficult in such patient because there can be laryngeal edema, and the patient can collapse anytime because of respiratory arrest. So we have to involve anesthetist as well. So what will be the management? Management following a stabilization. Suppose the patient has stabilized after giving intramuscular adrenaline. You will have to see that he is discharged with like safely. He should be given his medications. He should be given advice what to do, and see that he is safe to be discharged. So observation in emergency department is very important. Even after you see that the patient has responded well, his vitals have stabilized. So for how many hours will you observe such patients? That is important to know. So a Research Council of UK recommends that the following risk stratified approach for discharging any patient. Fast track approach is discharging within 2 hours of symptom resolution. This is suggested for patients who have responded to a single dose of adrenaline. Complete resolution of symptoms has been seen, and an adrenaline auto-injector should be given to the patient. The patient should be counseled regarding the allergen, that to avoid it completely, and encourage him to do so. And in case don't know the allergen, advise him to have a look keenly, see what is causing him to have, like what new things he might have taken, he might have used, which might have caused this. and safely, like how prompt he should be in coming to the seeking the medical attention. So adrenaline auto-injector should be given to patients actually at discharge. However, it's not available in India. So we can give a preloaded adrenaline syringe to him and advise him to use it promptly when required. Also, we can discharge him on antihistamines, which which can give some relief to him on the onset of the symptoms. And also, we should know that simple allergic reaction can be treated with antihistamine, while adrenaline autoinjector he can use when he's having some breathing difficulties, feeling dizzy. So next will be to keep which patient should be observed in emergency for 6 hours. A patient required intramuscular doses of adrenaline for more than 2 times. So we know that such patient can have a biphasic reaction. That is, first we feel that the symptoms have resolved, but the patient can anytime develop a reaction in 4 to 6 hours later. So hence, these patients should not be discharged before 6 hours of the resolution of symptoms as well. So another type of patients are patients who have received more than 2 doses of intramuscular adrenaline and they have severe ongoing reactions still, where there is no symptom resolution or the patient is still wheezing, patient presents late at night, or patient stays at such a place where he cannot seek prompt medical advice or cannot reach a hospital early. So such patients, even you can keep 12 hours at the emergency department and observe. Some patients who are not responsive to the adrenaline IM intramuscular dose are still symptomatic. They should be admitted ideally. So apart from the observation, other thing will be to do blood tests for him. And to diagnose anaphylaxis, we have tryptase, serum tryptase test. In acute anaphylaxis reaction, serum tryptase level rises 20% over the baseline serum tryptase, and also 2 nanograms from the baseline or rises from the baseline. So this says that the patient has anaphylaxis. So what is baseline and baseline tryptase? We should know. Baseline tryptase is ideally a patient's tryptase level, which is when he is asymptomatic. So when a patient comes with anaphylaxis, take a sample and test for tryptase. And that we will compare with a baseline tryptase that is checked after 24 hours of patient stabilization. So you will compare the acute tryptase level when the patient came with an acute presentation with the baseline tryptase. And if there is a rise of 2 nanogram per ml or 20% of the baseline, then we label it as anaphylaxis. And any newly diagnosed anaphylaxis patient should be referred to a specialist, allergy specialist. And this will help them in understanding or detecting the allergen. First of all, they can carry out different tests for understanding what has caused this allergic reaction so that they can prevent it in future. And also, they can prescribe him the relevant medications and the patient can follow up, because emergency, the patient can't follow up, but this patient may need a follow-up for further medication advice and to know what caused the anaphylaxis and what all food or what all medications the patient need to stop. As there is no follow-up in emergency, always better to refer a newly diagnosed anaphylaxis patient to a specialist. So this is the treatment and diagnosis of anaphylaxis reaction. Anaphylaxis, it is also called as anaphylactic shock. It is very important for a layman also to understand what is anaphylaxis and how prompt you should be in treating this patient or sending this patient to an emergency department or in the hospital to seek medical attention. So I have seen some patients collapse in front of me with anaphylaxis, and it didn't require intubation. However, the 2 doses of IM adrenaline, the patient responded, and it was overnight. We observed the patient in emergency, and it is quite a common condition nowadays in emergency, especially with the peanut allergies and seafood allergies. Despite knowing that they have allergy, they do consume and they land into anaphylaxis. So thank you very much, everybody, for joining me here, and I'm happy to share my knowledge with you.
Ma'am, we have few questions in chat box. So I'll go one by one. So maybe you can answer that particular questions and we can wind the session.
Yeah, sure.
The first question we have from Ram: how long should patients be observed in emergency room after stabilization?
Yeah. So patient should be ideally observed based on the response given, response to the adrenaline given. So once the patient is having a good response to adrenaline and the symptoms has resolved, 2 hours after we can discharge the patient. However, if the patient require 2 doses of intramuscular insulin, then we need to observe for 6 hours ideally. Patient may require 12 hours of observation if the patient has the symptoms has resolved, but the patient has come overnight. And in the night, you expect that he will not be able to come again, or he is staying in such a place where he cannot seek medical attention immediately. And you are expecting a biphasic reaction can occur. Biphasic reaction means he is stabilized, he looks stable now, but the symptoms can recur because they can be degranulation of mast cell basophils again, and then again the pro-inflammatory markers can cause further reaction once more. So in such cases, it should be observed for 12 hours. So maximum 6 to 12 hours for patients who require IM insulin, intramuscular insulin more than twice can be observed in emergency, or otherwise safely you can discharge a patient within 2 hours.
Okay, ma'am. We have another question from Kumar. How should anaphylaxis be managed if the patient is already on beta blockers or some comorbidities?
Yeah, beta blockers still you and adrenaline is the drug of choice because weighing the benefits and risk, you have to go with adrenaline as a treatment of choice, even for the patient with the beta blockers. So that is advised because it is a life-saving situation. Also, you can secure one dose of adrenaline will not harm the patient. Also, you can secure IV line and you can give fluids to the patient to compensate the circulatory shock.
We have another question from Venu. What should be the first step when someone is suspected to have anaphylaxis outside of hospital settings?
Again, can you repeat it?
What should be the first step when someone is suspected to have anaphylaxis outside of a hospital setting?
First step.
Yeah.
First step will be first to, if the patient can speak and he's stable enough, he can say that he has an allergic, he had such a episode before, then you can ask the patient whether he has a preloaded syringe of anaphylaxis, preloaded syringe of adrenaline, then you can give him the preloaded dose of adrenaline. If not, then immediately the patient should be laid down, given a head raised position, and we can call the ambulance, give him water, or if the patient is stable enough to drink, he's conscious enough. If not, you have to immediately shift the patient in ambulance to the nearest center because you don't have the drug of choice there.
Okay. We have one more question from Akash. When should adrenaline be administered and why is it considered the gold standard treatment?
It should be administered as early as possible. As I told you, if the patient is already a known case of anaphylaxis who had developed before anaphylaxis as well, so you should just give adrenaline immediately. It is gold standard because it reverses the mechanism which has happened in anaphylaxis, that is vasodilation and increased vascular permeability. So when you give adrenaline, there is vasoconstriction and the reactions are all reversed. And the blood supply to the important organs, that is brain and heart, is revitalized. So the patient's symptoms get improved. Also, his blood pressure will pick up because there is vasoconstriction with adrenaline.
Okay. We have one question from Pawan. Are there any common mistakes people make while managing anaphylaxis at home or in clinics?
Yes, first of all, it is just thought as a normal allergic reaction. So when you just consider it as a normal allergic reaction, you're bound to miss anaphylaxis, and the patient, when you realize that it is anaphylaxis, the patient is collapsing, you may lose the patient. Second thing is you may in clinic setup also, patient may not have all the airway breathing circulatory problems. He may just come with just as normal, like he will just say, he will deny that he's having any breathing problem. So when you don't auscultate, when you don't hear the wheeze, you don't know that the patient has anaphylaxis, and you can just treat it as a simple allergic reaction with antihistamine, just observe him. But there is a prominent wheeze, and suddenly when you are just giving him an antihistamine, the patient can collapse, and then you know that the patient was having some symptom of anaphylaxis, which was not addressed.
Okay. We have a question from Shiva. Why does blood pressure drop in anaphylaxis?
Yeah. So anaphylaxis, a histamine which is relieved as a pro-inflammatory marker, and other pro-inflammatory markers like and cytokines and leukotrienes, all these things, they will cause vasodilation in the body blood vessels, which will cause the drop in the blood pressure. And also the fluid leaks out of the blood vessels and goes into the interstitium, thus resulting in the decrease in the blood pressure.
Okay, ma'am. We have one last question from Vishal. What is the best way to manage anaphylaxis if you are at risk?
How do you know that you are at risk? You cannot know, like anaphylaxis is a sudden presentation. Yes,
Okay.
if you have a family history, you can take precautions of not taking the nuts or seafood allergy, but yes, once you know that you have some allergy, you have to be like prompt, like what food have you consumed or what new medication have you taken, which resulted in this allergic reaction. Usually you will be able to, because anaphylaxis happens within few hours of the exposure. So you should be able to identify the allergen, and avoiding the allergen is the treatment. And you don't know whether you are at risk or not. If you are at risk by family history, you can simply avoiding the allergen is the best treatment, or best therapy prophylaxis you can do.
Okay, that's all. That's all we have questions in the chat box. So before we wind up the session, I just wanted to take 2 minutes of my time and show what exactly the MedWorld is, which made this session happen. So let me share my screen. I hope everyone can see my screen. Can you see my screen, ma'am?
Yes.
Okay. So most of the people who have joined over here are medical students and practicing doctors, and you are also a doctor. So MedWorld Expo is one of the unified healthcare digital platform where we are creating an ecosystem into complete healthcare. So here the major thing that we do is connecting manufacturers and distributors in our platform. Apart of that, we also have complete healthcare professionals in our platform where they can browse different kind of medical products, where they can attend webinars, CME programs, and they can have latest news and insights. Like if you wanted to find out the latest, what is the new updates in the equipment, what is going in the health, what is going on in the healthcare, complete all the insights can be tracked in our site itself. And we have a medball blog option. Ma'am, as a doctor, you can also post any kind of blogs if you wanted to write about any kind of topic. It might be anaphylaxis or any kind of other topic which you wanted to share. Even you can also post any kind of blogs over here. And people who have joined in the session, you as a medical students, if you wanted to write or if you wanted to question something about any doctor, about any specialties, even you can post any kind of such things over here, so that you will be getting good kind of responses in our platform itself, because we are into completely into only healthcare. So you will be finding out right doctors for you over here. So people who have not registered in our site, so please do register, and you can write blogs also, and you can even participate in upcoming webinars as well. And we have medical communities. You can create your own community over here based on your specialty and find or network new people within the healthcare network, so that it might be one of the major advantage for you, and it is a great opportunity for you to find people within the healthcare network itself. And we have medwell journals. So if you are writing any journals, or if you wanted to repost any kind of journals, our platform is right choice for you to post your journals in our platform, so that you will be able to access multiple range of medical and healthcare journals in our platform itself. And we have career advancement option and magazines, so you can browse different kind of medical magazines. And in career advancements, you can able to find the pathway to complete your education in abroad, so right from the consultation. So if you wanted to pursue in particular country, so we will be able to guide you, like how to start, what is the process, which kind of specialty do you need to take, what kind of department you have to go, how many years, everything can be done through our platform. So we will be giving a complete career guidance opportunity over here. So it is completely free of cost for all the healthcare service providers like doctors, medical students, and everyone who were presented in the platform. So I hope you all need to utilize this, one of the best opportunity which we are giving. And the other thing is we are giving job option. So even you can browse different kind of job opportunities within the healthcare networks. So if you're looking for a job, so our platform is right choice for you to browse the jobs, and you can apply directly to the hospitals, biomedical companies, and other kind of medical sectors or medical organizations. So please do check out our platform, and I can show you our success stories. We have more than 6,000 manufacturers, 7,000 distributors, and 7,800 service providers, which means doctors, hospitals, and so on, all the healthcare sets within the healthcare services. And we have more than 1,90,000 products. So even you can browse what are the latest products, who is manufacturing, who is distributing. So these are all options we are giving it for you. So please take out some time for us and open the platform and check out what all the features that we are giving. And that's all about MedWorld, ma'am. And thank you so much for your time, ma'am. It was a very, very wonderful session. I hope we will be doing some more other sessions with you soon.
Thank you so much for inviting. I'm
Thank
happy
you,
to
ma'am.
share my.
I hope you'll have a very good day. Thank you all for joining. Thank you, ma'am.
Thank you, everyone. Bye.